Hi, my name is Dr. Jane Hendricks, and I'm a naturopathic physician and the owner of Garden of Health, and I would like to speak to you for a couple minutes on hormone metabolism. You can get bioidentical hormones from your traditional gynecologist or your primary care. However, in conventional medicine, they do not address hormone metabolism. Progesterone is a pretty benign hormone, and so it doesn't come with negative side effects, except sometimes if there is way too much progesterone, you may experience some weight gain or water retention and some bowel, possibly constipation. However, progesterone is a very safe hormone. So specifically, I want to speak to estrogen and testosterone. I use a 24-hour urine test that looks at not only your hormone levels, but your metabolism of these hormones. So these two lines here is looking at the liver metabolism of estrogen. And then this area over here is looking at the metabolism of testosterone. These are great hormones, especially as we reach middle age. For both men and women, we need support in hormones. It's anti-aging, keeps our stamina and our libido up, helps with muscle to fat ratio. And so we definitely want to address deficiencies in these hormones, all three of them. However, estrogen, if too much in the body, carries a long-term risk of cancer, uterine, cervical, ovarian cancer, breast cancer. There could be a genetic predisposition. I call genetic predispositions in all medical conditions like the log that's sitting in a fireplace, and the match that lights it up is that environmental influence that just lights up that gene to manifest into a medical condition, whether it be autoimmune disease or cancer. And so I, as a prescriber of hormones, don't want to be lighting that match, especially when there's family history. So I do like to use this 24-hour urine test ahead of time to look at the liver function, especially with estrogen. So we can see these metabolites, some of them being harmful, that cause mistakes in DNA and cancer, and I can address that naturopathically. That's the great thing. We do the test, and then we address the liver metabolism of estrogen through natural supplementation and diet. And actually, it's going to even increase the effectiveness of your prescribed hormones. You'll be making better use of it and breaking it down and avoiding the side effects of estrogen, which is weight gain around the middle, mainly, and water retention. Testosterone, the clinical side effects of testosterone is the hair growth on the face and hair loss on the scalp, the opposite of what we would want, and acne. And so with testosterone prescriptions, oftentimes a woman might be prescribed spironolactone. That's a medication that can deal with the side effects caused from the conversion of your good testosterone to the harmful, stronger testosterone, DHT. I don't want to call it harmful, but stronger. It's a stronger form of testosterone that can contribute to acne and hair loss on the scalp, hair growth on the face. There is an herb that can help with that. There's some herbal combinations that you can use instead of spironolactone. So while I may use it short term to handle these symptoms, I'm hoping to transition the patient to a safer long-term form of the DHT blocker. And that has to do with an enzyme called 5-alpha reductase, which is on that report. It's about a 7-page report. I just showed you page 2. So it's 7 pages, and I go through it with the patient so that they can see for themselves, oh, wow, these are the 2 pathways for estrogen metabolism. Oh, there's that 5-alpha reductase. I believe that a doctor should always educate their patients on how their body's working, because then that's empowering that patient to take care of themselves. That is the true answer to prevention of disease and to really society as a whole. So I spend that extra time with each patient on going over these reports with them. And keeping in mind with this hormone metabolism, that is with or without prescription. So I see patients just for hormone imbalances of your own hormones, so PCOS or weight gain. Again, the hair stuff that happens as you reach middle age with or without a testosterone prescription, it just starts happening. So I look at hormone metabolism for these patients that are coming in with this unexplained weight gain and hair stuff and acne. So we always want to look at hormone metabolism in any case. If you have any questions, fill out the appointment request on my website, or obviously to schedule an appointment, fill out the appointment request on the website, or you can call the office. I do offer 10-minute complimentary consultations. While I can't diagnose and treat on the phone, I can certainly answer any questions that you might have about what to expect at the first visit if you've never seen a naturopathic doctor before. And so feel free to call my office to schedule that 10-minute complimentary consultation.